whenever we hear the word cancer, people connect it directly with death. So मैं ये जानना चाहता हूँ that do you think death from cancer can be prevented?
There are 4 reasons why people are suffering from cancer. Your number one reason is people are not coming early, getting themselves diagnosed early. Initiatives both by the government, by various private companies, by hospitals who work in cancer, doctors themselves, a lot of initiatives are being pushed towards early diagnosis. So everywhere you'll find placards saying early diagnosis, early diagnosis. So there's a lot of work being done towards that. But there are 3 other reasons, which are sort of silent, which no one really talks about. The second reason is, people don't budget their treatments in cancer properly. If you don't go to the specialist at the first outcome, they will not explain your entire disease to you, and they will not tell you what your journey might be like. What happens is then later suddenly you realize, okay, you need chemotherapy, you need radiation, you might need immunotherapy, you might need whatever treatments ahead. And then slowly what happens is, you run out of funds. Third very big problem in our country, as I explained earlier, was that people try to go and take too many opinions. Problem in cancer is everyone says they can treat cancer, and it's a problem in society for that. Every person, any doctor you go to will be like, cancer ho gaya, don't worry, I will manage, And the number 4 reason why cancer results are not so good in India is because people are not rehabilitating themselves. Cancer has 4 wheels, Number 1 is surgery, number 2 is chemotherapy, number 3 is radiation. The 4th wheel is also rehabilitation. Rehabilitation doesn't mean going and taking physiotherapy. People say, okay, diet, physio, psychological and all that. It is keeping a proper, follow-up of the patient, ensuring that the patient is doing well, what problems they have, trying to detect any recurrences early. Okay. So there are a lot of aspects to it. Rehabilitation is important because now we know that our results of treatment have become so much better that we know that our patients are going to survive longer, maybe 5 years, maybe 10 years, maybe 15 years. So now our focus is obviously staying true to the protocols of cancer treatment and ensuring that they survive longer, but also that they should live a normal life.
Okay.